Welcome to Acupuncture 123 Live. I'm Szenan-Balance from Szenan-Balance, the acupuncturist. Now today we're going to talk about how to use Dr. Tan's Balance Method Acupuncture to instant relieve pain in the groin as well as hip. Okay, so where is the hip pain? Okay, we talk about pain over here, right? This is what we want to treat today, and pain over here as well. The groin and as well as buttock. All right, so we have covered on the previous 6 video, we have covered all 6 meridian over here. Today is a conclusion live. Okay, so this conclusion we're gonna talk about what a pain over here, like in the groin. Okay, acupuncture 3 meridian, which is stomach meridian, spleen meridian, liver meridian. Are you going to treat one by one, or if patient tell you about pain in here, a quick and dirty way, balance all these 3 meridian. You have to go, you don't have to go precise and see, hey, which meridian is that? Okay, just go needles, balance all those 3 meridian. Okay, now we know this is yang ming, tai in, and jue in, right? On the opposite side, this is yang ming, last intestine point. Over here, tai in, lung point. Over here, jue in, pericardium point. Okay, simple. The side here, on the top as well, this is yang ming. This is gonna treat the stomach meridian. Go to the front. Over here, what is this one? This is lung, tai in. We're gonna treat the opposite side of the groin of the spleen meridian. Okay, and go lower to reach the front in crease of the armpit. Okay, this is pericardium, which it can balance liver. So from here to here, you get ulcer point. If you have 2 or 3 ulcer point or ulcer point in between, you just needle it. Okay, and it'll give you instant relief over here. Okay, simple, quick and dirty way. Then the hip pain. We talk about pain in the groin, 3 meridian. Hip pain. What is no sign? The sign of the hip, a sign of the body over this area. There's a hip. This is sound in, foot sound in, gallbladder meridian. So which one can we treat that? We're gonna treat it as using Szenan meridian. Where's Szenan? Over here, large intestine. Go back here. This is Szenan meridian, right? Over here. This is Szenan meridian. Last intestine on the side, back. This is Szenan. Okay, which is from here, go down here. Szenan meridian. Any point in here, around here, then it can treat the pain in the hip. Very simple, isn't it? So pain in the buttock, pain in the butt, pain in the butt. Where do you treat that one? So this is a bigger area, very big area. Okay, so we're gonna treat it over here, which is in the back, lower, in above, around the in of the back of the crease of armpit. Okay, this is small intestine. Okay, point around here and go to the upper back as well, on top of scapula, and that'll cover all pain over here. Okay, so the back of the in of the armpit over here, above here, and this area, from here to here, this area, and all along here, on top of the scapula. All this are small intestine, and that here can treat barial point. Okay, so all along here can treat all pain over here. Okay, very simple. Okay, quick and dirty way. Okay, we cover all 5 meridian now. So you can pain in the butt. This is what all this point. This meridian is bladder meridian. Then the last one is kidney meridian. Where's kidney meridian? So whatever you can see in here, bladder meridian. But something that you can't see is hiding in between your leg, but in the back. Okay, not in the front. If it's in the front, it'll be in here. This is spleen meridian and liver meridian. But behind here, it's still on the side, okay, on the side. The kidney meridian go up here. It's not obvious in the back here. It's not in this area. It's more inside here, okay, and between your leg, okay. Normally you can't see it. If the pain, say, oh, I have pain in my way, my when I go to toilet, with that part of my with my urine below that pain, or a bit of behind there, and that's kidney meridian, okay. And kidney meridian, you're not going to treat over here, okay. You're going to treat in the armpit. In last video we talk about it, okay. This is very sensitive when you use your patient's hand, get their hand and to press over here. You hold their hand and press, 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 press. You get the ulcer point, and then you get a tube, 75 75 mm of needles, a long one, and get a tube over there and put their armpit down and insert the needle and slowly insert the needle. If they feel pain, stop it and pull back a little bit, pull back a little bit, and change some of the direction and keep going in, okay. And then you will hit the point, then you get this over here pain to ulcer point to treat the kidney meridian. That is very, very simple, okay. So all this thing I put it all together, how to treat 6 meridian. If you want to go individually, go back to previous 6 videos, okay. All this 6 video, you get individual meridian to learn all individual meridian, how they balance, and where is the ulcer point, okay. In this video we're going to talk about how quickly when patient come, it's very seldom that you get patient come is just 1 meridian. You're lucky if you just get 1 meridian. It happen, okay, but a lot of times it cover more meridian, so you just go, okay. Process problem I am in there, okay. Yeah, all your problem we're gonna talk about next in the future, okay. What you just said, all the structure problem, okay. All the structure problems, spine problem, I choose JIYI Foundation Acupuncture, okay. I'm not saying that Dr. Tan's balance method can't treat it. In some cases, Dr. Tan method is good for structure as well. But when we attain Dr. Tan's balance method, Dr. Tan said that in his acupuncture there are 3 things that doesn't work well. Okay, it doesn't mean you can't treat it. It doesn't work well. So number one thing is ear problem. Okay, ringing sound. Okay, because Dr. Tan himself suffer from tinnitus and hearing issues, and he tried to use Dr. Tan's his own method to treat it, and it wasn't successful. Okay, so he told us that so ear problem doesn't work well, doesn't work as well. But I do use Dr. Tan's balance method to treat tinnitus successfully, but you have to combine other technique. Okay, we'll talk about it in the future. And another problem is overuse symptom. Now, overuse symptom is you hammer, okay, you hammer and suffer from pain in the wrist, okay, or mouth symptoms, okay, and you treat it, you get instant relief, and when you go back and they keep doing it, it keep going because you overuse it, and that is something that is very difficult to treat. It doesn't mean you can't treat it. Yes, you can treat it, but I find it overuse symptom doesn't matter what method you use, and it always difficult to treat. Okay, not just Dr. Tan's balance method. And the third things that Dr. Tan's mentioned about is structure change. What does structure change mean? Like spine curve, lumbar hernia, the disc herniation, sclerosis. All these things are difficult, and because the structure change, and so Dr. Tan's method doesn't work as well, okay, as the normal pain, okay. This is Dr. Tan told us that, okay. No, I didn't make it up, and but in my clinic, in my practice, I do use Dr. Tan's method acupuncture to treat lumbar disc herniation. successfully, but not for every cases. Not for every cases. Some cases I couldn't, so I use other method. I prefer use JIYI Acupuncture, which is a method that is work very well for structure issues. So I learned a lot of type, a lot of style of acupuncture, and at the moment I find that JIYI Acupuncture, which I call foundation acupuncture, is the best for structure issues. Okay, I if I use Dr. Tan's balance method that it doesn't work well for those structure, and I use JIYI Acupuncture, and always give me good results. Okay, and I have a lot of picture about it, and I'm going to do a webinar, a free webinar to introduce JIYI Acupuncture in Chinese next Friday. But unfortunately, if you're watching this video, you won't be able to understand Chinese, so you will be able to join us. Okay, but I would do a video to introduce JIYI Acupuncture in the future in English. Okay, it'll be free in webinar as well. I got the permission from Dr. Master Liu, and I allowed to do that for you guys, and to try to promote his method. And if everyone love this method and you can try it to use it, I'm gonna teach you how to use it. A few pointers for lumbar disc herniations. Okay, um, I want to talk. Last thing is to let you know that if you love my video so far, please thumbs up, and please share my video to your social media platform. Share with your friends, your colleagues, to let them know that I'm here to do a free teaching in Dr. Tan's Balance Method Acupuncture Local Balance. And if you love this video, you want to join in for a free webinar, you go to this video and in the description area, and there is we talk about how to join into our Facebook group. So in the Facebook group, and this Saturday, I'm going to teach a webinar for 2 hours about details for local balance of Dr. Tan's Balance Method, and it's for free. And after this class, and when you come back again to see all my live video, you'll be very clear what I'm talking about. Okay, rather than follow me step by step in a daily video. But after those 2 hours, you feel, oh, fantastic, everything is so simple and easy to practice, and very easy to get instant relief. It will blow your mind. Okay, so alright, I'm Szenan-Balance from Center of Balance, the acupuncturist in New Zealand, and you stay awesome. I'll see you tomorrow night. I love you all. Bye bye.